Welcome to this week's Workers' World Labour Show. I'm your host, Helga Jansen-Daubia. Joining us in a bit is Michaela Miller with this week's Labour News. While there's been big improvements in the government's procurement and rollout of the vaccinations to South Africans, we are far from safe. Many medical experts have predicted a fourth wave of COVID-19 to hit the country next month. We've already seen huge spikes in new cases in certain European countries like Germany and Austria, despite those countries having much better healthcare facilities. While we are already entering the beginnings of a fourth wave of COVID-19, the political economy of medical care, pharmaceuticals, and specifically vaccine supply remain a major issue. In today's show, we explore the stumbling blocks for ensuring that the overwhelming majority of people are vaccinated, especially in Africa, along with the political economy of vaccine manufacture and supply. Before we get into our studio discussion, let's take a look at an insert produced by the Workers' World Media Productions editorial team.
I-vaccine njengoba ibayilethile ibalekile ukuthi wonke umuntu sehlabe. The way ngibone ngakhona ngibona ngathi manje seyehlile nenamba ukuthi abantu abaphathwa yi-corona since abantu abaningi sebehlabile.
There is much improvement since the start of the rollout of the vaccine in South Africa. Even in hospitals, as we can hear, things are not the same the way they used to be.
Vaccine, it will suppress this virus than before.
I'm feeling very optimistic because of the statistics that is showing that as the vaccine has been rolled out, the numbers has been dropping.
Thus far, the vaccine is really working. So a lot of people is now they overcoming this disease, and less people is dying. The vaccine is making a difference.
There are 7.8 billion people living in a world in the grips of the pandemic, and vaccines for only 650 million of them. Produced and distributed by only a handful of large pharmaceutical companies, and so far distributed mostly to rich countries of the world. To change that, countries like India and South Africa are urging the World Trade Organization to introduce a temporary patent waiver for producing COVID-19 vaccines.
Vaccines are a political issue, and that part of the reason that we haven't got a mass rollout in South Africa, there may be local issues around maybe poor planning and procurement, but there are also international issues which relate to patents and relate to how intellectual property is used to control the market of vaccines and to control the price.
What happens when a vaccine manufacturer starts bullying? Governments are silenced, supplies are halted, and profits take precedence over saving lives. I'm not describing a hypothetical situation here. I am describing what Pfizer is doing. The American pharma giant, it is doing all of this. It is bullying countries to submit to its demands.
Africa, we represent 4% of those people who have been vaccinated around the world, despite our population. It's the same for South America, many parts of the global south. The global north have hoarded the vaccines for themselves.
All the vaccine companies, the companies who develop the vaccines, they've got a lot of patents around it, and it is protected by intellectual property, and we are demanding that intellectual property and the patents must be waived so that more vaccines can be manufactured, so that more people can at a faster rate get access to the vaccines, because we are also saying nobody is safe until everybody is safe.
TRIPS, which is a trade agreement. It's trade-related intellectual property rights. It normally, as a trade agreement, when it was established, it allowed countries who had intellectual property. So, for example, when you develop a vaccine or you develop a particular, like with its software, so anything that you develop that can constitute what they refer to as intellectual property, you then go and register it, and then through the global trade agreement, you basically stop other countries or companies from trying to compete with you.
Mid-90s, end of the 90s, this began to cover medicines, intellectual property around the pharmaceutical industry, which meant that it became almost impossible for countries around the world, poorer countries, to import or produce generic medicines that didn't have patents. This was done in order, at the behest of the more powerful, the rich nations, to protect their pharmaceutical industries.
The issue of transparency, the government is not coming forth to the table with disclosed books, with open arms to say we are buying this vaccine at so much. The issue of equitable access. Africa itself will be left alone as a COVID continent since the global north is pre-ordered more than they need to vaccinate their population.
Western countries have already procured 67% of the entire global vaccine. And because they have resources, they could procure, twice number of their population. You see, Britain procured, 4 times of what they need. And then what are we saying about countries that are poor, third world countries? So I think we felt that we need to raise awareness to say that there should be equitable distribution of a vaccine throughout the world.
One of our demands is for the transfer of technological and other knowledge so that other companies and developing countries can also manufacture the vaccine.
We need a new system which allows people the right to life-saving medicine, and this must override patents. This must override the interests of the pharmaceutical.
This is not a time to make money, it's not a time to make profit. Every single pharmaceutical company needs to make sure that the technology to make COVID-19 vaccines is accessible to everybody, and that all who can produce it do that, because if we don't vaccinate the entire world, if we're not all safe, then none of us are safe.
Welcome back. Joining us now is Michaela Miller with this week's Labour News highlights. Michaela, what's on the agenda this week?
Well, Helga, we have quite an extensive bulletin today, but to name a few, Nehawu heads to court after calls on the ANC to pay their workers' salary. And Setsahu General Secretary and International Domestic Workers Federation President Myrtle Witbooi receives this year's Silver Rhodes Award for a contribution to the struggle of domestic workers worldwide. All this and more later in the full bulletin. To get into this week's topic of discussion on COVID-19 and the political economy of vaccines, back to you, Helga.
Thanks, Michaela. We're joined in via Zoom by Dr. Leslie Bamford, Acting Chief Director, Child and Lead of Vaccination Rollout Program from the National Department of Health. Thank you so much for taking the time, Dr. Bamford.
Good evening, and good evening to the viewers.
We're also joined by Professor Leslie London, a People's Health Movement member, certainly no stranger. We've seen you a couple of weeks ago, Prof. London. Thank you so much for taking the time again.
Thank you for having me.
Prof, let's start with you. It's been almost 20 months, just a little bit over 20 months. COVID-19 is now a way of life. But there are concerns. What are the concerns of the People's Health Movement in particular about the pandemic, both in South Africa and on the continent?
Well, we've had an epidemic that's really exposed how inequitable our health systems are and how inequitable global health economy is. because we have huge inequalities between countries and inequalities within countries. So the vaccination problem has simply landed on a very unequal base. And we've seen how countries of the north have been able to achieve very high vaccination rates. Most people in the south are still waiting for their first vaccination, and people in the north are getting their third, sometimes even their fourth vaccine. So there's something deeply unequal about that. And that is the People's Health Movement's primary concern, that we need a more equitable response to the epidemic, and particularly equitable access to the health technologies that can save lives, such as vaccination.
Dr. Bamford, let me bring you in here. So equitable, I mean, from media reports, it would seem that our vaccine rollout is going along swimmingly. Do we have enough supply in the context of what Prof. London has just said?
So I think it's something of a mixed bag. We are certainly pleased that we have now in South Africa been able to vaccinate over 40% of adults, but that does mean that 60% of adults remain unvaccinated and unprotected. Currently in South Africa, we have sufficient vaccines. We do not have any vaccine constraints. That was not always the case, and early in the year, we did have very limited supplies of vaccines. But we are also then very concerned about other countries in Africa that still face similar vaccine constraints, the constraints that we experienced earlier in the year.
So, Prof. London, constraints, but supplies are up and running again. However, there is intellectual property around, and I'm going to use a colloquialism, the recipes for these vaccines. And the World Trade Organization is, of course, the regulator of access and ownership of these pharmaceutical recipes. Where does this fit into the economy of access to the vaccines, and where is South Africa positioned on this?
So South Africa is actually an upper middle income country. It's hard to believe it. We're a very unequal country, but we have quite a lot of money compared to the rest of Africa. Our economy is a big economy. And in fact, South Africa has purchased vaccines through bilaterals in the main. Whereas other countries can't afford to do that. They have to rely on a mechanism called COVAX, which was set up by the World Health Organization and other donors to try and give low-income access to vaccines, to purchase them. And COVAX has been hugely underfunded. So COVAX is not able to supply the kinds of coverage that are needed for adequate immunity in countries in Africa. So we have this disjunct, Dr. Bamford has just described that in South Africa, we've at least got to 40% of our population, and in other countries, it's less than 5%, less than 2%. And they can't afford to buy vaccines. COVAX is not delivering enough vaccines because the vaccines are being sequestered by countries that can buy them. And we bought for our population, but countries of the north have bought maybe twice, 3 times. Canada's classic, it's bought 6 times the amount of vaccines it needs per population. So there's that huge inequality, and that arises because countries in the south or production companies in the south can't produce the vaccine because of the ownership of the intellectual property, that sort of recipe, as you call it. And that is what the waiver is about. It's at the World Trade Organization, which is to say that during this emergency, when people are dying from preventable condition of COVID, we need to be able to unlock that recipe so that the producers in the south can produce enough vaccine to supply the whole of the south.
Prof. London,
don't see vaccines getting to poorer countries, and that's the issue.
Let me just remind our viewers, because we have raised this before, I think, on this program, that India and South Africa have been instrumental in terms of tabling equitable access to these recipes so that countries can manufacture. Where is South Africa and India on this in the WTO universe, if you like?
So the waiver was initially fiercely resisted. Many countries from the north resisted it. But strangely enough, a lot of countries are coming around, even the US. And so the waiver is now being discussed in terms of its text. So it's sort of the devil in the detail now. There are still many countries opposing the waiver, and they say, well, the normal exceptions to intellectual property under the Doha Declaration and other WTO documents, the TRIPS agreement would cover it. But in fact, there is discussion progressing, but it's very slow. And as you might imagine, countries that have big industries they want to protect will resist and fight. And that is all in process now. Civil society is pressing hard. South Africa and India continue to press for this waiver. But we're not sure exactly when the WTO Council will make a decision, and if they will make a decision that really enables production in the South, because this is what it's about. And the waiver is, of course, an important step, but it's not sufficient. There actually has to be technology transfer and the building up of capacity in the South to produce the vaccines safely, of good quality. And South Africa can do it. There are other countries in Africa that can do it. The Africa CDC is supporting it. The development banks of the world are supporting it. We just need the framework released by WTO to be able to do it.
Manufacturing capacity in the global South, Dr. Bamford, what does this mean for South Africa's ability to step into support for the continent in terms of making sure that there's equitable distribution of the vaccine and greater access?
So I think it certainly is true that the COVID pandemic has exposed limitations and the fact that very few, if any, vaccines and other medicines are produced in Africa, including in South Africa. So clearly we manufacture medicines, but very little in terms of vaccines. So I think we must acknowledge that in terms of vaccine manufacturing, this is not a quick fix. It's not just about having the recipe.
Dr. Bamford, can I ask you just to pause, and we'll come back to the not a quick fix after this break. To you at home, don't go away. We'll be back. Welcome back. Dr. Bamford, just before the break, we were talking about South Africa's capacities and the role that they could potentially play on the continent in terms of vaccine rollout.
So absolutely. As I was saying, in terms of manufacturing vaccines, this is not a quick fix, something that we can set up overnight, even once the issues related to intellectual property, and as you spoke about having the recipe, that's an important first step. But there needs to be tech transfer. There needs to be significant investment. But certainly there's no reason why in the medium to long term South Africa cannot become self-sufficient in terms of manufacturing many vaccines, and also being able to supply other countries in Africa and the rest of the South.
Dr. Bamford, while I have you on this point about other vaccines, some political parties, some activists have questioned the Sputnik and Sinovac vaccines. They've not been procured or used. There was a big problem with the pharmaceutical companies' monopoly of the market. Some were saying the abuse of their position. What is your view, or at least the Department of Health's view, on rolling these vaccines out into the vaccine pipeline, given that they are cheaper?
Well, I think, can I start by saying that they're not necessarily cheaper? So currently, as you know, in the vaccine rollout, we are using two vaccines, the Pfizer vaccine and the Johnson & Johnson vaccine. The Department of Health has also indicated that we would consider using two further vaccines as part of the vaccine rollout. Those are the AstraZeneca vaccine and the Sinovac vaccine. The Sputnik vaccine is not currently registered by SAHPRA, so it is not available for use in South Africa. So currently we have sufficient vaccines, but we may in the future look to procuring the additional vaccines that I have mentioned. In the medium term, we need to move to a system where we procure vaccines, COVID-19 vaccines, in the same way that we procure other vaccines, where we issue tenders that all the companies are able to bid, and then we would award tenders looking at how good the vaccines are and taking issues of price into account.
Prof. Leslie, let me bring you into this part of the conversation as well, as we're talking about different manufacturers and their capacities. Pfizer and Johnson & Johnson have insisted that there's extremely disadvantageous contractual conditions for supplying vaccines. Of course, this is about the expansion and the growth and the power of the vaccine market. What is the People Health Movement position? What is your position on the notion of contracts and contractually strong-arming governments to procure this very important common good?
So we've seen that the contracts have largely been non-transparent. So we don't know under what conditions governments are procuring from the companies. And that's part of the deal with intellectual property, the secrecy that governs these contracts. And when they are secret, it is possible for companies to exercise power that is much more in favor of them, in their favor. And the point is that many of the efforts to set up local production that we've seen lately have really not changed the intellectual property ownership arrangement. So, for instance, a foreign multinational will support a South African company to fill and finish a vaccine, but there's no technology transfer in that arrangement, and the intellectual property remains with the parent company. Or the arrangement is such that there is some measure of devolution of skills, but the decision about who to sell to and at what price, that of the company. And that is part of the problem, that is what the waiver seeks to alter, that in fact the intellectual property on a public good can't be held by one entity, and many of these entities are entities that have developed the vaccines based on large amounts of public funding.
Yeah.
I mean, Pfizer got billions of euro to develop their vaccine, but the mRNA vaccine, particularly amenable to local production in the south, if the skills are there and the technology is there, because it's a vaccine that can respond more nimbly to new variants, which we're going to have to live with in the next while. So I think there's a lot of pressure from the companies to keep it under control, and an unwillingness to relinquish any of that control because they want to decide where they get profits from. And that system is just not sustainable. It's not compatible with an emergency. So we need a different way of doing things. If a company wants to decide how much it wants to sell a computer printer for, I'm okay with that. That's fine. They put in the intellectual energy to that. But we're talking about a public good that saves lives, and we can't have the same arrangement for that kind of technology.
Prof. London, without becoming too conspiratorial, and I have asked you a question like this in our previous show in the same vein, but do we see the real politic of the globe becoming or influencing this vaccine economy, as the Workers' World Labour Show is coining it? That Russia and China, of course, have very specific global political ambitions. The continent of Africa doesn't have the capacity. They might potentially be able to provide cheap vaccines. Is the continent going to become a power ball in this game within the vaccine economy, without being too conspiratorial, of course?
Well, I think the continent is already part of this geopolitical decisions. China has very aggressively promoted its trade in other areas. So why should it not promote its vaccine in other areas? And the same with Russia. So I think that in reality, we would be very naive to think doesn't exist in relation to vaccines. Nobody's doing this simply because of the public interest or wanting to do good. So we just need to be mindful of that in the decisions, about which vaccines are procured and how they're procured and who fights hardest to get onto a procurement agenda. I'm sure there's lots of lobbying and lots of political pressure and perhaps economic pressure to do so.
Let's change tack here for a moment, Dr. Bamford, and let's talk about rollout, as in needles in arms. We have, previously before our break, you did say that generally we've vaccinated up to 40%, but let's talk specifically about the vaccination of children. Where are we with that? And again, just explain to our viewers why children only get the single shot Pfizer vaccine. Those are the ones between 12 and 17 years old.
So I think the first thing that is important to say is that we have opened vaccination up to 12 to 17-year-olds, and we do encourage them to come forward and be vaccinated. We wanted to make sure that our matriculants could be protected before they wrote their exams. And we are also hoping that more young people will come forward as school terms end and they're on holiday, etc. But having said that, our real focus of the rollout does remain reaching as many adults as possible, and particularly older adults, those 50 years and older, and especially those 60 years and older, because we know that those people are most at risk of developing severe COVID and dying from COVID during the anticipated fourth wave. So it's a two-pronged message. On the one hand, those are the people who are most important to reach, but at the same time, if we want to open up society, return to some kind of normality, then we have to vaccinate as many people as possible, and that includes both adults and children 12 to 17 years of age.
Thank you so much for that. When we come back, we'll be joined by Michaela Miller with this week's edition of the Workers' World Labour News. Don't go away. We'll be back after this.
Welcome back to Workers' World Labour News. Thanks for joining us. The National Education, Health and Allied Workers Union, COSATU's biggest affiliate, headed to court to force the ANC to pay its employees' salaries, which have been outstanding since August. NEHAWU General Secretary Zola Sipeta yesterday announced that the union has opted to take the matter to the High Court because it believes that the non-payment of ANC's staff salaries is dishonest and a contravention of the law. Among the demands made were the payment of outstanding salaries and contributions to the Provident Fund, Unemployment Insurance Fund and medical aid benefits with immediate effect. Sipeta revealed that in addition to the legal action, NEHAWU is also trying to mobilize not only the workers of ANC, but to get solidarity support from other union members in other sectors, because an injury to one is an injury to all, and this matter has been going on since 2019. Trade unions have welcomed the National Assembly's adoption of the long-delayed Employment Equity Amendment Bill this past week. The bill empowers the Minister of Employment and Labour to set numerical EE targets for any national economic sector after a process of consultation with the relevant sectors. In future, state contracts will mainly be granted to employers who have been certified by the Minister as being compliant with the obligations under the Act. These obligations include compliance with ministerially determined sectoral targets. A designated employer's compliance with the law may also be measured against the sectoral demographic numerical targets set by the Minister. While trade unions like COSATU might be praising the amendments for affirmative action, certain employers, political parties and groups of workers are likely to be unhappy. The South African Municipal Workers Union welcomed the decision by the SA Local Government Bargaining Council when they dismissed an application by the City of Cape Town to be exempted from implementing recent government salary wage increases. The city sought exemption from the recently concluded multi-year salary wage agreement, which was concluded on September 15th. The decision by the arbitrator to decline the city's application is a huge victory to the 30,000 workers who are in the employ of the city of Cape Town. SAMU said that they cannot allow a situation where municipalities use the COVID-19 pandemic as a reason why they cannot honour the salary and wage collective agreement. On the 12th of November, the non-profit organisation, the Alternative Information and Development Centre, commemorated a quarter century of the organisation's contribution of supporting the building anti-capitalist movements and formations in the country. Some of its notable achievements was in support to the establishment of the World's Social Forum, founding of the Right to Work, and the 1 Million Climate Jobs campaign. The AIDC's anniversary event also paid tribute to its founding director, Brian Ashley, who has stepped down from his position. Brian was the support of many comrades and have played a significant role over the past 25 years in South Africa, the continent and the world, and many activists and organizations are appreciative of the excellent work that he has done. AIDC also used the opportunity to introduce their newly appointed director, Dominic Brown. We wish him and the AIDC community well on their new journey together. This year's Silver Rhodes Awards was presented to Myrtle Witbooi for a contribution to the struggle of domestic workers worldwide. Witbooi has worked for more than 5 decades, organizing domestic workers and mobilizing support for the cause, starting a trade union activism under the apartheid regime in Cape Town in mid-1960s. Stand by for a short video on Myrtle and watch as Sarah Raycliffe hands over the award.
The spirit of Anene Boise, long live!
Born under South Africa's deep apartheid divides, Myrtle Witboi's first organizing work took place in private homes. At an early age, she saw the impact of injustice without representation.
In 1967, South Africa was still in the grip of apartheid, and domestic workers was actually just depending on women. And because women were majority black women, uneducated, we found ourselves as domestic workers.
She began to organize domestic workers in her employer's garage, an act of resistance worthy of imprisonment at the time. Her voice became one of the first public figures to campaign for the rights for this isolated group of women workers. Myrtle organized South Africa's National Union of Domestic Workers, the largest movement of its kind.
Make sure that domestic workers are included in your decisions making in your country. Make sure that domestic workers get recognition that their work is decent work.
In the new democracy, she posed hard questions to government leaders. Who ironed their shirt that day? Who looked after their children? Who cleaned their homes? Challenges that led to the adoption of 5 national labor laws, including unemployment insurance and maternity benefits. In 2008, Myrtle's impact multiplied as she became the president of the first international organization of domestic workers, which played a powerful role in achieving the only global policy for domestic workers, the International Labour Organization's Convention 189, now ratified by 35 countries. Under the global COVID crisis, she led an international process that secured crisis relief funds for domestic workers, literally saving lives and reducing the impact of this virus amongst those on the front lines of care. Myrtle Witboi's life commitment to domestic workers and women's rights has made immeasurable impact around the world in both tangible policy and economic forms, and is a magnanimous emblem of social justice worldwide. Her commitment to domestic workers inscribes the highest calling of life achievement as a direct service to justice, peace, and solidarity.
Domestic workers work isolated from other workers. They actually live alone. They stay in the backyard of the employers. Also, domestic workers are not really protected with social security and social benefits. So that is actually why they still called a vulnerable sector. But we are hoping that changes will come for the domestic workers.
We've been here in Community House for many, many years, and I've watched you build this union and struggle through all the problems that we have on a national level, take it to a global level, and build the IDWF. On behalf of Solidar, because I'm here as proxy for Solidar, I want to congratulate you on your achievement and hand over to you the Silver Rose Award for this year.
Thank you. I would like to say that I accept this award, but it's for the workers. It is for our struggle that's not finished yet. And I hope this award will give me the strength to carry on this fight, to get workers to recognize that they have got labor rights and we won't stop until we are free. Thank you.
Well, that's a wrap from my side. If you have any story you'd like to share with us, you can send a WhatsApp message or a voice note to 081 552 4551 or simply send us an email to labour@wwmp.org.za. To conclude this week's topic of discussion on COVID-19 and political economy of vaccines, back to Helga.
Wow, Michaela, an amazing and remarkable achievement and recognition of Comrade Witboy's
Yes,
work.
indeed. Certainly no stranger to the workers' world.
Absolutely. To you at home, don't go away. When we come back, we'll conclude our discussion. Welcome back. We're talking the political economy of COVID-19 vaccines. And with us in studio, we've got Professor Leslie London from the People's Health Movement. We're also joined by Dr. Leslie Bamford from the National Department of Health. Dr. Leslie Bamford, we've got two Leslies this evening. Before the break, we ended that segment where you confirmed that the goal of vaccination for COVID-19 is still to vaccinate adults, especially the at-risk groups of over 50s and over 60s with comorbidities. And we understand that. But what about other chronic and communicable diseases that people still suffer with despite COVID? How is our public health sector managing the return of diabetic patients, chronic cancer patients, mammograms, etc.?
So certainly we know that during the COVID pandemic, sometimes there have been disruptions to our services. Sometimes people have been fearful about accessing our health services. And so that we know that we have lost ground in terms of ensuring that people with HIV, with TB are identified and put on treatment. So we know that in addition to dealing with the COVID pandemic, so we really have three tasks. We have to respond to the COVID pandemic, we have to vaccinate people to protect them from COVID, and we have to make sure that essential services recover and investment is made in them so that they can provide services and gain the ground that has been lost during the COVID pandemic. So that's really a huge task for the health sector. But as I say, if we are going to improve the health of South Africans, then we need to take on all three of those tasks.
Prof. London, the cost of these life-saving drugs outside of COVID, I'm talking about HIV medication, cancer medication, TB, this is still largely a big part of the political economy of access to drugs for life-saving medication. Am I correct?
That is true, and we have a lot to learn from the experience around HIV about how to ensure that treatment can be accessible and affordable for people who need it.
And of course, this also points to accessibility for those drugs on the continent. So what can South Africa do if we think of the COVID-19 experience and its challenge to TRIPS waivers? Does this open the door for South Africa and others in the African Union to lobby for cheaper life-saving medication? Because COVID is but one of a list of other diseases on the continent.
So that's true. I mean, to the extent that the waiver at the WTO is really talking about the COVID epidemic and about vaccines and about any health technologies related to COVID, it's quite a narrow waiver. But the principle is that countries that have big health needs should be able to access the things they need for their population to either stay healthy or to be treated or to be rehabilitated. And the current system is not good at doing that. For instance, for TB, the last drugs developed for TB for a long period were in the 60s and 70s, and we had no drug development for TB because the people who got TB were not a paying population, so pharmaceuticals didn't invest in drugs, so-called neglected diseases. And we have a number of those. TB has received some sort of attention recently because of a lot of public pressure, civil society, TB survivors, organizations, but there are many other diseases for which we need similar kinds of interventions. And the same problems that we see with the COVID vaccines exist for how we get to cheaper medication for those diseases. Some of the newer TB drugs are very expensive, and we can only bring them down in price through state tenders that buy in bulk. And again, we need to have local production, and that will certainly improve the quality of life of people in the South. And we need to learn from the fact that when it came to HIV, there was a strong public civil society lobby. Governments were really shamed into supporting pharmaceuticals, keeping prices high, and competition was introduced because of the measures, and that's what drove prices down. And that's what we need to be able to see here, because if you have multiple producers producing good quality medication in the South, the prices can't stay up. They will come down, and there'll be greater accessibility. And that applies to preventive technologies as well, diagnostic technologies, all of it.
So, Dr. London, Dr. Leslie, all these L's tonight. Dr. Leslie, maybe you can shed some light on precisely the point that Prof. London makes, which is about accessibility. Will the Department of Health, or at least, maybe let me rephrase the question, what are the big lessons that the Department of Health will implement as we look at the trade, the market, the purchasing of other life-saving drugs? Are there any lessons that have been learned from this COVID experience, and what will go into the next cycle of purchasing?
I think probably the biggest lesson that we have learned is the importance of having local production. We have reasonable levels of local production for many medicines, but not necessarily some of the newer medicines that are now being developed to treat COVID and other conditions. And then I think we've also spoken about the lack of capacity to manufacture vaccines, and that is an area that will receive a lot of attention going forward, starting with fill and finish, but clearly needs to move on to making sure that we can manufacture vaccines for use in South Africa and beyond South Africa.
Thank you. Prof. Leslie, the last question goes to you, and it is perhaps about organizing and mobilizing. I know that there are civil society campaigns against the monopolies that these big pharmaceuticals have. Just tell us a little bit about what the People's Health Movement will be doing in the immediate period as the next phase of the rollout starts and we anticipate the fourth wave.
Well, I think part of what PHM's agenda is to raise public awareness of these issues. So we have worked quite hard at developing information for communities so that these grand and complicated ideas such as the World Trade Organization, intellectual property concepts are translated at community level so ordinary people can understand what it is they can expect as a right, because access to healthcare is a right in our constitution. And what does that mean in practice? Well, it means a system which is able to access what you need to be healthy in a way that's affordable for the country. And part of that is understanding that it's a good thing that South Africa is pushing for this TRIPS waiver. I think we are still going to meet opposition, so we are going to have to network with colleagues and other organizations, comrades overseas and other social movements. There's big pressure building up behind that. There are certain countries which remain in opposition, for example, Norway, which is very strange because Norway has always been a great supporter of the anti-apartheid movement, but on this they seem to be dead set against the sort of social justice agenda, and they are quite influential in the vaccine environment and in COVAX, for example. So I think we can expect a lot of public advocacy, social mobilization, information, press, engagement with policymakers, and support actually for the South African government in the negotiations, because it strengthens the hand of southern governments if civil society is backing them, and that's what we will do.
And of course, we've had lots of lessons from the HIV/AIDS campaigns around the world led by South Africa. So we've got those lessons to draw on.
Sure, but we shouldn't rest on our laurels. We have to do the work.
Absolutely. My thanks to Dr. Leslie Bamford from the National Department of Health, and also to Professor Leslie London from the People's Health Movement. To you at home, indeed, making vaccines and life-saving drugs more accessible does require greater input and greater lobbying from civil society. From me, Helge Janssen Daubia, here at the Workers' World Labour Show. Good night, till next time. Thank you so much to both of you. It was great to have you.